Almata offers treatment and education to youths between the ages of 12 and 18. The facility is situated in the woods near Ossendrecht in West Brabant, the Netherlands. There are various residential groups on the site. The youths follow theoretical and practical schooling, and there is time to relax and play sports. Our goal is to reduce the problems connected with growing up as much as possible, and to work on a better future. Youths are placed in Almata by the Judge for Child Protective Services. When a child is placed here, he is often brought to Almata by his parents. We take the child on a tour of the facilities with his parents so he can get an idea of the surroundings and see the residential group where he will be living. After that, we go to the residential group and the child can take his parents and bring his things to his room. When his parents have seen his room, then they say their goodbyes and the child can start setting up his room and putting his things away. He also has a chance to get used to his situation and make a transition. There are 10 youths living in each residential group. There are girls groups, boys groups, and mixed groups. Different treatment methodologies are utilized. There is always a group leader present. All of the youths have their own bedroom. Each group has a common kitchen, living room, and outside area. The education and treatment of the youths occurs predominantly within the living space. Sometimes, a child that has recently arrived at Almata doesn't want to cooperate. Treatment is required and the youth has to conform. Our first goal would then be to motivate the child to cooperate. We prefer that the child participates in the program of the residential group. Sometimes that doesn't work, and the child can go to his room and calm down. That is permitted. The youths are in a closed treatment situation. That means that they can't just go anywhere or do anything they want to. In the beginning especially, the privileges are limited. Almata is a closed residential treatment facility for youth, but we don't have fences or gates around the complex. The outside doors of the residential group and the doors to the individual bedrooms are locked. The youths can participate in various activities while accompanied by a group leader. After approximately 2 weeks, they are permitted to go outside under accompaniment and do things like take a walk or participate in sports. The longer the child is in care at Almata, the more privileges they have. We aren't strict at Almata. What we are is clear and consistent. If one group leader says no, then the other one will also say no. At Almata, no means no, and yes means yes. The daily program at Almata is a fixed program. From the moment the child wakes up until he goes to bed, everything is planned. That way, the youth is not confronted with surprises, and he knows what to expect. The structure creates clarity and calmness. The youths eat together within their own residence. Setting the table, clearing the table, and doing the dishes are part of the program. Other activities are done collectively, and some are done individually. School is an important part of the daily program. The youths that come to Almata often have behavior problems. They often have had poor experiences at other schools. In our school, they are taught in small groups so that they can learn something in spite of their behavior problems. At Almata, the youths are prepared as well as possible for continuing education or initial practical qualifications. Each youth has a custom treatment plan. The long-term goals are determined together with the parents. There is one group leader that pays special attention to the youth. We call him the mentor. He is the contact for the youth. The youths work on their goals. One goal could be, for example, that the youth doesn't get angry as quickly in certain situations. The youth practices these goals within the group and discusses this later with his mentor. We want to teach the youths that it's okay to make mistakes, because by making mistakes, you can learn. We want to teach them not to keep their problems to themselves, but to talk about them and solve them. We think having contact with the parents is very important. The parents know their children the best. If we run into problems with the child's behavior, we contact the parents and ask them how they deal with this problem. In this way, we learn from the parents what the most effective manner is to deal with their child. Because Almata is a closed facility, there are rules. For example, the youths are not allowed to use a cell phone. Parents can call their children at predetermined times. This is also the case for personal visits, in cooperation with the treatment coordinator. I think it's nice when parents or other family members come for a visit. We normally try to plan that for weekends. Sometimes a parent or family member comes and cooks a meal for the group together with their child. It's really fun. Almata has various continued treatment plans. For example, Thuisbest, Fasehuis Plus, and other continued treatment at other facilities. We treat the children as short as possible and as long as necessary.